Hello all, I am Mrs. Winnie Matthew, nursing tutor working with Oyster Nurses Academy, Tiruvalla. We provide guidance for the prometric examinations to different Gulf countries, Saudi, Oman, Qatar, Bahrain and UAE. Today we'll see about amyotrophic lateral sclerosis. In short, we call it as ALS. ALS is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, causing loss of muscle control. Moving on to the symptoms. Signs and symptoms of ALS vary greatly from person to person, depending on which neurons are affected. It generally begins with muscle weakness that spreads and gets worse over time. Signs and symptoms includes difficulty walking or doing normal daily activities, tripping and falling, weakness in the legs, feet or ankles, hand weakness or clumsiness, slurred speech or trouble swallowing, muscle cramps and twitching in arms, shoulders and tongue, inappropriate crying, laughing or yawning, cognitive and behavioral changes. Moving on to the causes, ALS affects the nerve cells that control voluntary muscle movements such as walking and talking. ALS causes the motor neurons to gradually deteriorate and then die. Motor neurons extends from the brain to the spinal cord to muscles throughout the body. When motor neurons are damaged, they stop sending messages to the muscles, so the muscles cannot function. Moving on to the diagnosis, ALS is difficult to diagnose early because it can mimic other neurological diseases. Tests to rule out other conditions includes EMG, MRI, lumbar puncture, muscle biopsy and nerve conduction study. Treatment. Treatments cannot reverse the damage of ALS, but they can slow the progression of symptoms, prevent complications and make more comfortable and independent. The Food and Drug Administration has approved 2 drugs for treating ALS, riluzole and edaravone. Doctor might also prescribe medications to provide relief from other symptoms including muscle cramps and spasms, constipation, fatigue, pain, depression, sleep problems, excessive saliva and phlegm, uncontrolled outbursts of laughing or crying. The therapies includes breathing care, physical therapy, occupational therapy, speech therapy, nutritional support, and psychological and social support. Thank you. See you all soon with a new video.